Primary immunodeficiency is an incurable genetic disorder of the immune system. When a child is born without natural protection, they lack an immune system, and any small illness or injury can be life-threatening. When receiving adequate substitutive therapy, patients with primary immunodeficiency can live a full and active life. It is very important that patients understand how the healthcare system is structured in their region, how the medical supply system is arranged. What information does the patient need to provide in order to receive medication free of charge at their place of residence, on time and in the quantity required? The patient and the attending physician communicate constantly, and without this interaction it will be impossible to treat patients at all. Our experience in our patient schools, however, shows that when a doctor and a patient meet in a different environment, communication reaches another level. Questions that have remained unresolved or not asked can be answered in our schools, where they can be discussed and a common solution found. Sunflower is the first and only organisation that deals with the problem of primary immunodeficiency in Russia in a systematic way. Collaboration with leading experts in immunology, paediatrics and rheumatology. Work with specialised medical institutions throughout the country. Deep integration with the patient community. In general, Russia has very low legal literacy. Unfortunately, people are not used to getting information about their rights and implementation of those rights. At the patient schools, during the focus on the legal aspect, we try to explain to people that in fact everything is not so scary and not so difficult. There are some basic principles and techniques that can be applied universally in many situations. So, after attending the school, people are not only able to tackle current problems, they can with time use the same techniques to solve other questions, or even share their experiences with similar patients and help them solve their problems. Firstly, it is very important for patients to communicate with one another, to find common experiences and to understand that they're not in a unique situation. And secondly, it often happens that a patient with primary immunodeficiency is unique in their region, and they can for some time suppose that they are isolated from people suffering like them. Misunderstanding the disease creates yet more stress and fear, for example, during hospital visits. A young person will not always be a sick child. Very soon they grow into an adult patient and must become responsible and able to stand up for their rights. Understanding their diagnosis and treatment, knowing their rights and the support of loved ones helps patients live a full, active life without being a hostage to the disease. This can be learned by questioning doctors, sharing experiences with other patients. Thus, for several years, the Foundation has been running schools where patients gain knowledge from leading experts and become part of a large and active patient team.